If your child needs a crown, you need to see this video before making a decision because most parents don't really know what they're getting. Hey, if you're new to me and new to this video, I am Dr. Jasmine Elmore, a board-certified pediatric dentist, breathing, myofunctional, and airway expert. I don't do rushed appointments and I don't cut corners. People want to know how I see what other dentists miss, and so I created this YouTube video for parents to check out inside of my mind because several of you asked, so you can get an inside look as to how we make sure that your child's dental care is not just good enough, but we make sure that it's precise, personalized, and built for a lifetime of health. Yes, parents strive to see me and my team because here, every detail matters. And that's why they call me Dr. Elmore, AKA Dr. Detail. Every concern is heard, every tooth is examined, and every treatment plan has a solution that is custom to each child and one that lasts. So I don't follow the rules most offices live by, I rewrite them. If you're done settling for, let's call it basic or routine dental care, and you want true, meticulous, science-based pediatric dentistry that we call optimal care here at Optimal Kids, then you're in the right place. All right, so what's the difference between a stainless steel crown and a zirconia crown? Well, first of all, the zirconia crown, as you'll see shortly, is a white, natural tooth-looking crown, and the stainless steel crowns have a silver appearance. If we're talking about the front of the mouth, I think most people already kind of are wanting a zirconia crown versus a stainless steel crown that may be pre-veneered with a white facial to it. But some people don't mind a little bit of metal showing. So we'll talk a little bit more about the appearance in just a second once you see the model. Biocompatibility and safety. Let's talk about that next. So we have the ceramic-based material that the zirconia is made of. We can dig deep into the science at another time, or I encourage you to look into zirconia crowns so you can educate yourself. But from a very simplistic standpoint, the zirconia crown is considered to be more biocompatible or friendly for the body, whereas these stainless steel crowns are made out of a variety or an alloy of metals. One of the main metals is nickel, and a lot of people have, myself included, have nickel allergies. And so the potential of the nickel release to the gums and also throughout the body to cause allergy is very high, okay? So let's look at the model right now and take a look. So guys, I have on some gloves. Let's take a look at this model of the teeth and talk more about the stainless steel crowns versus the zirconia crowns. As you can see here on this tooth model, we're looking at a stainless steel molar crown. So let's talk about the molars first. The stainless steel crowns have been along for a very, very long time. I'm not going to bore you with the science, but this is what the visual appearance of the metal crown would look like. A lot of people opt for these because if we were to have the gums surrounding the mouth and the cheeks are kind of in the way, most people can't really see the metal crown. Ignore the teeth in the front. That's for when we get to the front teeth crowns. But the metal is a little difficult to see in the back. So for aesthetics only, again, the metal is noticeable. For a lot of people, they don't mind. For many, many more, again, it's not an aesthetic thing, it's a health thing. They don't want to have metal in the mouth. They want to have a more biocompatible option. So again, this is what the stainless steel crowns look like. And I'm now going to show you what the zirconia crowns look like. Now we have lots of different brands of zirconia crowns. They come in a variety of brands. The brand doesn't really matter as long as it's durable and it works well in the doctor's hands. But this is what the particular zirconia crowns that we use here. Here's what they look like. And the zirconia crown is always going to be a little bit bigger than a silver crown just because of the way that the material has to work in the mouth. But you can see here, and these model teeth are going to be a lot whiter than most people's natural teeth. So keep that in mind. No, the color does not match. But again, people aren't coming in with these super white teeth like this. So we need to keep that in mind. But there is the appearance of the zirconia crown. And again, parents are coming in time and time again, more so recently, because they want that natural looking appearance. They want the biocompatible capabilities of the crown. Now, I've heard a few things, most of them are not based in fact, about the durability of crowns. Keep in mind that everything is as durable as you make it. What I mean by that is a kid that's grinding their teeth really badly, a kid that's biting into very hard things is going to have a hard time with either the silver crown or the zirconia crown. But from a standpoint of durability, both of these are considered to be very durable. The zirconia crown is engineered, again, to naturally blend in, if you will, with the tooth. They pretty much tend to be very fracture resistant. I've seen none of mine so far of this video have fractured. Same thing with metal crowns. None of the ones that we've placed have fractured, but I have seen where you can wear through the metal on the stainless steel crowns if a kid is grinding often. But again, these are engineered for excellence, both crowns. But if we're looking at durability of the zirconia crowns, I mean, they've been around long enough and they're engineered for a very sustainable future. Again, these crowns are going to be glued onto the baby tooth until the baby tooth falls out, whether we're talking about the silver crown, the stainless steel crown, or the zirconia crowns. Okay, so that's what the molar crowns look like. We're going to take a look in a second at some of the options for the front teeth crown. Before we take a look at the options for the front teeth crowns, yes, I've changed my mind. Something else I wanted to mention. Preparation of the actual tooth for a crown. There's going to be more preparation for this silver crown than there would be for the zirconia crown. And if we take this view here, I hope you can appreciate that the metal crown is a lot thinner than the zirconia. There's a thickness there to it. Anything white's going to have that thickness no matter what the material is, but specifically the ceramics. And so the preparation will have to be a little bit bigger for those crowns. Okay, so now let's talk about the front teeth. Let's look at the pre-veneered. All these crowns are pre-veneered, but the prefabricated. But the prefabricated silver crowns with the veneer on the front that's white versus the complete all-around zirconia crown. So let's take a look at that next. So here we go, guys. No, the crown does not fit perfectly because it was not, the preparation of the tooth was for the zirconia crown, but let's roll with it, okay? So here's a front tooth here. Again, it's longer because the tooth was not prepared for it, but I wanted you guys to appreciate what those white crowns look like. I think aesthetically it looks great. Again, not with this being long, but just the crown itself. I think they look really good. Yes, sometimes a little bit of the silver that lies on the back end, as you can see here. If the child opens their mouth really, really big, then yeah, that silver on the inside would be noticeable. But overall, I think the aesthetics are pretty good. But again, if you're looking for low metals in the body, low metal or no metal alternative, then obviously this wouldn't work for you. But what we do have, and of course the fit will look a little better because the tooth was prepared for this zirconia crown. But here's the zirconia crown. And again, the natural teeth of most people is not as white as this model, but it has aesthetics. Those little numbers on the inside wear away, but it has, let's focus, there we go. The numbers on the inside wear away, but the aesthetics are very, very good. Again, they come in different brands, and this is just the brand that we use here in the office, but just impeccable aesthetics for these zirconia crowns. And so when it comes to making a decision about whether or not you want metal or the zirconia, it's completely up to you as a parent. Yes, the zirconia crowns are going to be more expensive. Let me pull those back out for you guys so you can see. And let's put it right here on the white paper so it's easier to see. When we're talking the zirconia crown versus the pre-veneered metal crown for the front teeth, or the zirconia crown with the on the molars with the stainless steel crown side by side. If we're comparing, the cost, of course, is going to be higher for the zirconia versus the stainless steel. One, because it's more technique sensitive for the zirconia crowns. A dentist is going to have additional training they need for those. The material itself is more expensive. So yes, parents will have a higher cost, but peace of mind, confidence, and less, again, of that inflammation for most parents is why the decision is made for many, or people seek out our office for the zirconia crowns versus the stainless steel crowns as far as the molars go. And then same thing for the front teeth as well. So the takeaway I would say is that the crowns are more than like a, just glued on the tooth procedure. There's a lot that goes into it as far as the oral health of the teeth. Again, the silver can have the nickel in it, which is not as healthy and biocompatible from a confidence perspective. Most people are going to prefer the white. And so if you want more than just routine care, if you want details, science-backed results and information, then you got to go the Zirconia route. Or at least that's what parents are coming in for. If you want your child's crowns done with precision and care, then I'm Dr. Elmore, aka Dr. Detail, and we go above the standard, okay? You're gonna get the education. We're gonna inform you of what's going on. We're gonna make sure we take care of your child and make sure that care is exceptional. So come join us here at Optimal Kids. If you like this video, please give it a thumbs up and consider subscribing, because I'm gonna bring more of these videos to you where you can learn and see what's going in your child's mouth. I'm Dr. Elmore, aka Dr. Detail, board certified pediatric dentist and breathing, airway, and myofunctional breathing, airway, and myofunctional expert. And until next time, I'll see you in the next video, guys. Bye.